Welcome back. This is your Feel Good Breakfast show. 1st of December, we're talking World AIDS Day with Dr. Darren Green. And our lines are open for you to ask your questions or make your comments. 083-913-3728. Some very, very interesting things that we mentioned during the ad break that we'll get to right now. But I think if you could maybe just walk us through what happens when you go to a testing facility and you want to get tested for HIV AIDS. What happens? Take us through that.
Yes, so the HIV counselling process involves, firstly, voluntary counselling and testing. In this case, where the patient will present to the clinic saying, listen, I want to be responsible about my health. I want to look after my family and decrease their risk of exposure. You will then be counselled as to exactly what the test entails. And that would obviously normally involve drawing of blood. Now, you get a stat test, which is called a rapid test, because it's quite quick and the results are available right there, where they take a drop of your blood and drop it onto a little strip, and that shows you then either positive or negative. But that's not the most sensitive test. That's a screening test. If that test is then positive, obviously you will then be counselled regarding that result, the risk, the implications, the lifestyle modifications required, and also the options of therapy that will then be disclosed. Then you'll also need a follow-up test or a second test that's a lot more accurate, which is called the HIV PCR test. And that one looks at the DNA of the virus specifically, and that one can be picked up as soon as 4 to 5 weeks after being infected with HIV. Before, obviously, people used to want to wait almost 3 months before it would be demonstrable on a blood test. So wonderful and accurate test with a 98% sensitivity and specificity, very useful.
Okay, I want to talk about the testing itself. I mean, we know that there is no cure for HIV, yet treatments are effective, so enabling us to live longer and live happier lives. So we're saying it's not a death sentence if you do have it, if you're watching this morning. The latest recommendations is that people go on ARVs straight away. Is that correct?
Yeah, the WHO, and I think Prof. San related to it a little bit earlier, recommends that all people with HIV go onto ARVs. There's an option A and B on the WHO list at the moment. You can imagine the cost implications for governments across the world. What science and research has shown is that the decreased incidence of opportunistic infections and cancers associated with HIV is significantly decreased when people go onto ARVs with CD4 counts less than 500. Before it, for example, when I worked as a Cosmo doctor, it used to be about 200. We'd only start people on antiretroviral therapy if their CD4 counts dropped.
So later in the
exactly. So now in South Africa, our guidelines are 500. When you've got a CD4 count of 500, we start you on ARVs.
All right, so there's lots still to talk about. Dr. Darren Green will stay with us. 083-913-3728. That's our telephone line, which is open to you for questions or comments. But right now, Graham, what do you have, man?